her tight and wrap her up. There you go. This is it?
Yep. Church hall
At the church.
/ clinic.
My family's been here for 13 generations, as well as my husband's on both sides has been traced back 13 generations. So we've both been here, born and raised here. I went away to school, we come back and got married. My mother's still here, and my husband's father's still here. He does the ferry boat, so that was the boat you come over on. So that was my father-in-law.
Smith Island is one of my absolute favorite things to do, to come to the island. I would come here even if it wasn't part of my job. The culture, the patience, the scenery, just the whole entire ambiance of the island is something that I don't think you can find anywhere else. It's such a special place. The residents here are welcoming, and I truly, truly enjoy the privilege to come here to care for Smith Island residents.
It means a lot to the patients because they typically don't like to leave the island. You know, it's an older population, and it's really hard for them to get on a boat and travel for 45 minutes and then worry about getting a car. You know, some of our patients have not left the island in 20 plus years. And we try to encourage everybody to connect to primary care, but we're kind of here to serve that gap in between.
We are very fortunate to have a full-time medical assistant employed by TidalHealth that lives and works here on Smith Island. She is our eyes and ears when we are not here. She is the island's immediate access to care. So if there's any medical issue for any of the residents, they know to call Janet.
As a medical assistant, my job is to check people in. I'm also cross-trained. I can draw blood, do EKGs, and when they're not here, I also can do like their workup for them. I'm like their eyes here and their hands here. So I can be their eyes and hands for them while they're not here, doing the telemed stuff. I'm employed Monday through Friday, but I also am a EMT on the ambulance. So I'm kind of 24-hour care for people here on the island, which I love. I'm glad I can help them. Yeah, so we work with the bare minimum, and we can make do in a pinch with anything. So we've got just the basic supplies here. We have an EKG machine, and we have the lab.
We do flu shots. The health department actually comes over and does shingles vaccines and pneumonia vaccines.
We do have some staples if somebody needs to get, which Aaron and Tammy has to be here to do that. But yep, we can patch you up, but we work with what we got, and it works.
It's awesome to come over. It's a very tight-knit community. When we first started coming, it kind of took a little while to form relationships with the people and kind of earn their trust, but they've really welcomed us with open arms and are always looking forward to seeing us and treat us as part of the community.
I like to be able to help people. That's my thing. I just love to do that. And in hindsight, I like to, in the future, see that somebody's going to help me.
So if we didn't exist, like, people would have no choice but to go over to Salisbury or, one of the areas. They have to take the boat over to be seen, and a lot of people just put it off. There's some people here that say, I'm just not leaving. Like, I was born here and I'm gonna die here, and if that's what it takes, I'm just not going.
Yep, the church is the center of the community. That's the whole community. So if there's ever a problem or anything, everybody always meets to church. And they look up to the elders, the retired watermen with the achy joints and bad backs and all that. So everybody here looks up to the elders and their wisdom and their knowledge of how things are.